This is a review of Module 3 Quiz Part A, and I will pick selected questions to review. This is the question about the component of skin, the cell in the skin, and the correct answer were either melanocyte, or Merkel cell. Only 49% got correct. Okay, here we said, okay, use images 1 and 2 for orientation, image 3 is enlargement, image 2. So 1, 2, let's see, I need just a minute. I clicked on the link so we could see 1, 2, and 3. Okay, so you got this area, this is skin, you're looking at the epidermis, you've got a boxed in area here, you're looking at a epidermal peg, part of the epidermis projecting down, interposed between two papilla of loose connective tissue in the papillary layer of the dermis. And then you're asked, what post-mitotic cell? Well, all of these cells in here are potential to divide, and they're stem cells in the basal layer, and they give rise to cells that eventually become the keratinocytes. But there's another cell that's here, and that is the melanocyte. Now, we also gave credit for the Merkel cells, which often are out here, can be in this area, and they don't divide either. They're nerve receptor cells. So I'm going to go back now to the question itself. And so we could have just stuck to the lymphocyte, or excuse me, I misspoke, the melanocyte. But we decided that it wasn't fair to not include the Merkel cells because the Merkel cells are very close by. And again, they were post-mitotic. This question asks for, and you can use images 1 and 2 for orientation, and then which is true about the specimen, and I'm going to enlarge, well, you can see 3, and I have to move this slider over so you can see the other part of the question. Which is true about the cells indicated by the arrows in image 3? Okay, well, this is epidermis. This is stratified squamous keratinized epithelium. A lot of keratin here, very thick. This is the kind of epidermis would be on the sole of your foot. And you can see we've boxed this area. So here's be the stratum basale. These are stratum spinosum cells here, and then stratum granulosum. And then up here we said, okay, what is deposited between these cells? Well, it's certainly, they are not Langerhans cells because they're stratum granulosum cells. They're not the cells that secrete melanin because those are the melanocytes. They're not the Langerhans cells, or otherwise you would see a very irregular nucleus in a light stained cytoplasm. And they're certainly not stem cells because the stem cells will be down here in the stratum basale. But ceramidase, a wax-like substance, is located between these cells. This is the beginning of the waterproofing of the skin because that wax-like substance stays between all of these dead cells that are forming the barrier of your skin. This question asks for the dominant tissue in the area where the lines are, and you have to recognize it's the skin, epidermis, and dermis, and recognize that this is the papillary layer of the dermis, and this is the reticular layer here, and this is the hypodermis, or the panniculus adiposus. Panniculus, pan throughout, adipose tissue throughout this layer, which is really subcutaneous. This is strictly the skin, dermis and epidermis, and this layer, the reticular layer, has dense, irregular connective tissue, and that would be the correct answer. This question, only 37% of the class chose the correct answer. Antibodies can enter efferent lymphatic vessels to this location. So you were asked to select this true statement about the location of the yellow triangle. So we gave you a low mag so you can recognize that it's lymph node. Why? Because it has a lighter medulla, a denser cortex, and it has these light staining centers to these rounded oblong objects, which are lymphatic nodules with germinal centers. So all of that should have told you it's a lymph node. And then you're in the medulla, and then you've got these basophilic structures in the medulla, and those are medullary cords. And that is the point where plasma cells can be secreting antibodies, and they go into the medullary sinuses, and then they go out through the efferent lymphatic vessels, and eventually where the lymphatic vessels join the veins in the neck, that gets into the circulation. Okay, you were asked to respond to a statement, whether it was true or false, and the statement said this organ, the organ you're looking at here, which has a dense cortex and a light medulla, but no nodules. So what could that be? It has to be thymus. And then you're giving this as a clue, this unique structure, the Hassel's corpuscle, so that should really cinch it, that is a thymus. And so the statement says it contains mostly naive and T lymphocytes. Well, that's probably true, but also some B lymphocytes that form plasma cells. Never true in the thymus. B lymphocytes are present in the lymph nodes, in the nodules, and also in the nodules of the spleen, and also in the nodules of the tonsils, but never in the thymus. Okay, very few got the correct answer to this question. It was Langerhans cells can pass through this region. All right, let's look at this. It says choose the true statement about the region of this organ between the dotted lines on the right. Now, I need to magnify this so you can see what I'm talking about. It's talking about this. So here you have a medulla, and you have a cortex, you have nodules, you have a germinal center, got to be a lymph node. Then you've got this pink staining substance, reminds you of the and you know this is the cortex, so the capsule's got to be out here. And this empty space in here, that is the subcapsular sinus that receives the flow of lymph and some lymphocytes from afferent, going to AFFERENT, going to the lymphatic, to the lymph node. So this question, Langerhans cells can pass through this region. If that is the subcapsular sinus, and I need to probably go over this again. I'm not sure I paused the recording or not, but I think I showed you this. But if not, this is an enlargement. This shows the lymph node, the nodules, the medulla, shows you even germinal centers, one here. So it's got to be a lymph node, and you have a capsule here, and just under the capsule you have this clear area with lymphocytes in it, and that's got to be the subcapsular sinus. So if you go back over here, what's the true statement about that subcapsular sinus? Well, it's Langerhans cells from the epidermis that capture antigen and migrate into lymphatics from the epidermis and eventually find themselves coming into the lymph node by way of the afferent lymphatics. And none of these other answers are appropriate. Monocytes are in the bloodstream. Antibodies do not go from the subcapsular sinus into the blood circulation. And the high or tall cuboidal shaped endothelial cells are in the deep cortex. If you don't remember about that, you need to review that, where the T lymphocytes come out of the circulation and very specialized postcapillary venules. Okay, this question is asking about a vessel, but it doesn't ask you to identify the vessel. It asks you, this vessel transports blood between which two vessels? And the question is phrased like this: the structure encircled, and I got to move this over. Structure and vascular structure that conducts the blood between which of the two pairs. So it's referring to this vessel here. And this vessel is an arteriole. See, here's a venule, very thin wall, but this vessel has smooth muscle in it. And you could have enlarged this like this and see very clearly. You see the peak staining, and you see the flattened long nuclei compared to the short flat nuclei of the endothelial cells. And so it has about 3 layers of smooth muscle cells, and it's quite dilated, and it's an arteriole. So what two vessels does that transport blood between? Well, it's the muscular artery comes into this and goes out and feeds capillaries. So the correct answer would be medium artery or muscular artery in a capillary. This question, the bulk of keratin is synthesized in which of the locations? Certainly not in the stratum corneum, because by that time all the keratin is formed, and this is a transitional area where the keratin is fully formed. But the cells of the stratum spinosum, those are the ones, and we also call those cells keratinocytes, and they're the ones that are busy generating the keratin. Stratum basal is giving rise to keratinocytes, which then move away from the basal layer to get into stratum spinosum, where they do their function. But they're not producing a lot of keratin at all. This question is really asking you, where are the blood vessels that supply oxygen and nutrition to melanocytes? Where are these circulating capillaries? Well, the epidermis does not ever contain any blood vessels at all. So these two answers are totally incorrect. And the dermis reticular layer does have blood vessels, but that's deeper. The dermal papillary layer, which is exactly beneath the stratum basal, where the melanocytes are, that is the location of the capillaries that supply gas exchange and nutrition for melanocytes. Now this one, I think there was a post on the discussion board, the journey of a keratinocyte in the epidermis until it is shed at the surface can occur in as soon as how many days? I think on the lecture we said 4 to 6 weeks. 4 weeks is 28 days. And so I think that it asks as soon as how many days. So what our intention was there for you to pick the shortest periods of days, not the longest. And so 61% of the class chose 24 to 28 days, which we designated as the correct answer. This question reminds me to remind you to review the open and closed circulation. The question said, in the open circulation concept of circulation of blood within the spleen, blood flow goes directly from the central artery into which location? Well, it goes into the central artery directly into the swampy cord of Bellroth, which is composed of reticular fibers, and it has some macrophages in there that are waiting to capture old red blood cells, and it's a very swampy area. It's not an endothelial line channels, but that's the open circulation. The closed circulation is where the blood flowing through the central artery would go directly into a sinusoid. That's the closed circulation. And again, this question refers to something similar, that the cords of Bellroth are where old red blood cells are removed. And if that area malfunctions, then old red blood cells would not be removed. This question, an antigen that gains entry into the bloodstream must most likely be detected and responded to in which of the locations? It's the marginal zone of the spleen. The germinal center of a lymph node. Now that detects antigen in lymph. The cortex of the medulla of the thymus, that does not detect any antigen at all. The cortex of the thymus is busy making T cells. The medullary cord of a lymph node, that is where some plasma cells would be to put antibodies into the lymph, which eventually gets in the bloodstream. And the trabeculum of the spleen, that's the stroma of the spleen. That's collagen. So the only correct answer would be the marginal zone of the spleen, where you have cells that can capture the antigen as the blood flows through that area of the spleen.